Union test preps, top 10 CNA mistakes to avoid, and how to fix them. Are you getting ready for your CNA certification exam? Let's talk about the 10 most common mistakes students make, and how you can avoid them. Stick around, because tip number 10 might just save you from a retake. Mistake number 1, ignoring the candidate handbook. Your state CNA candidate handbook is like a cheat sheet for the test. It tells you exactly what to expect, what skills might be tested, what to bring, and even how long things will take. Be prepared. Download your state's handbook early. Highlight the list of possible skills. Learn which steps are marked critical or bolded. Note what to bring, such as identification, clothes, watch, etc. Review test day procedures and timing. Use included checklists to guide your practice. Mistake number 2, overlooking infection control. Infection control is required in almost every skill. A missed hand wash, glove mistake, or cross-contamination can cause automatic failure. Examples include touching clean linens with dirty gloves, not washing hands after resident contact, or adjusting a bedpan without proper precautions. Even small slip-ups are considered safety risks. Be prepared. Learn and master the full hand-washing process. Never touch clean items with contaminated gloves. Treat infection control as part of every skill. Always wear gloves when handling body fluids or soiled materials. Remove gloves correctly, no skin contact with the outside. Mistake number 3, skipping critical or bolded steps. Each CNA skill has a few steps labeled as critical or bolded. These are safety-related actions, like locking wheelchair brakes or checking water temperature. Missing even one of these steps means automatic failure for that skill, no matter how well you do the rest. Be prepared. Identify all bolded and critical steps in your handbook. Memorize and emphasize them in every practice session. Say them out loud during the skill for reinforcement. Use flashcards to drill them in. Review your checklist before starting any skill. Mistake number 4, relying on memorization alone. Memorizing steps isn't enough. During the exam, you'll need to move smoothly, use proper technique, handle equipment, and speak to the resident. Many students freeze or forget steps because they didn't practice the skill physically, they only reviewed it on paper. Be prepared. Practice every skill with real supplies, gait belts, bed, blood pressure cuff, etc. Use a partner to simulate resident interactions. Set a timer and simulate full exam conditions. Speak all steps out loud during practice. Record yourself and review for missed steps. Mistake number 5, not communicating with the resident. The resident in your exam is often a live actor. If you don't greet them, explain what you're doing, or check for comfort, you may lose points in communication, empathy, and safety. Care that feels cold or robotic can hurt your score, even if your technical steps are correct. Be prepared. Always greet and introduce yourself. Ask for consent before any physical contact. Narrate your actions clearly during each skill. Ask questions like, "Are you comfortable?" Use calm, respectful language throughout. Mistake number 6, incorrectly measuring vital signs. Vital signs require precision. Errors in pulse, respiration, or blood pressure, even just a few points off, can lead to failure. Mistakes happen when students rush, count too quickly, place equipment incorrectly, or forget how to recognize systolic and diastolic readings. Be prepared. Count for a full 60 seconds, unless your handbook says otherwise. Practice on real people, not just mannequins. Learn proper placement for fingers, cuff, and stethoscope. Inflate and deflate blood pressure cuff at correct speed, 2 to 3 millimeters of mercury per second. Double-check your numbers with an instructor or peer. Mistake number 7, rushing through the skills. Nerves often make students move too quickly, skipping steps, missing safety checks, or appearing careless. Rushing leads to forgotten communication, failed technique, or critical step errors, even when you know what to do. Be prepared. Pause and take a breath before each skill. Mentally review the steps before starting. Move slowly and deliberately. Focus on safety and resident dignity over speed. Practice at a slow to moderate pace to build control. Mistake number 8, skipping final safety checks. Ending a skill isn't just about completing the task. You must make sure the resident is safe, comfortable, and able to call for help. Leaving the bed up or the call light out of reach are serious mistakes, and they'll cost you. Be prepared. Always lower the bed after a skill. Place the call light within easy reach. Adjust pillows, blankets, or limbs for comfort. Ask if the resident needs anything else. Wash your hands before exiting. Mistake number 9, not asking for clarification. If you don't understand the skill instructions or mishear them, guessing can lead to doing the wrong skill, starting with the wrong supplies, or skipping critical steps. You're allowed to ask questions before the skill begins, so take advantage of it. Be prepared. Ask the evaluator to repeat or clarify instructions. Confirm if you're using a mannequin or live actor. Double-check which skill you were assigned. Speak up before starting, not during. Be calm and professional when asking questions. Mistake number 10, underestimating the written exam. Many students focus so much on the skills test that they don't prepare for the written portion. But the written test includes scenario questions, tricky wording, and covers a wide range of CNA knowledge, not just common sense. Be prepared. Study core topics: infection control, resident rights, ADLs, safety. Take CNA-style practice tests. Use flashcards for quick daily review. Study ethics, communication, and emergency procedures. Don't wait until the last minute to study. Looking for study help? For free practice tests, study guides, and flashcards for the CNA exam, check out uniontestprep.com/CNA.